Hello, everyone. Can you hear me? Hopefully, you can hear me. Welcome to this session. Can you hear me? Good. So, welcome to this session, Plenary D, where we'll discuss intersectoral collaboration. You've heard a lot about this. It has come up in several previous plenaries and discussions here at Escaide. But we will touch upon the cross-sectoral collaboration from a different angle, a little bit more practical, and the One Health approach, and focus on avian influenza. That has reminded us recently, again, how important One Health collaboration is, not only as a concept, but really to achieve efficient and timely response to these zoonotic threats. So we will give real-world examples from the expert speakers that we have here today, and we will discuss how we have success stories and we have opportunities to also develop further and improve this cross-sectoral collaboration on surveillance, on joint investigations and risk assessments. So without further ado, I'd like to introduce my co-chair, who is Carlos Das Neves. He's a chief scientist at the European Food Safety Authority and an expert also on this topic area on One Health and zoonotic diseases. Over to you, Carlos.
Thank you very much, Angeliki, and a very good afternoon to all of you. It's good to see most still alive at this late in the afternoon, but the topic, I think, should interest us all. And because it's really a global topic, today we're going to take the full lens. And for that, we have five amazing speakers, because Angeliki will also be one of them. But we will really go first, we will go out of the continents all the way to the United States with Dr. Richard Webby from St. Jude's Children's Research Hospital. He's also a WHO collaboration center. But then we will have also presentations from the European perspective, from the European Union level perspective, by colleagues from the European agencies, Angeliki for ECDC, and my colleague Andrea Gevelmeier from EFSA. We will also see the perspective from our reference laboratory centers with Alice Fusaro from the European Reference Laboratory. And finally, we'll zoom in a country, and we will fly to Denmark, or actually Ramona Trebian has already flown here to bring us the perspective from Denmark, all the way from the Serum Institutes in Copenhagen. So without further delay, we fly to the US to hear how are things going with avian influenza over there. Richard, the floor is yours. Thank you.
Thank you so much, and good afternoon all. Thanks for hanging in here. So I'm going to give you a little bit of a perspective, one, sort of bring you to speed on where we are with avian influenza and zoonotic infection. Then switch to a sort of a problem that I think many of you are aware of that we've been dealing with in the US for the past coming up on 2 years, when this virus moved into dairy cattle, and then been asked to provide a few pearls of wisdom in terms of advice through having gone through that outbreak. I will say, as you can see from here, I'm from a private research institution. So what I'm going to talk to about today and the experiences in dealing with H5 in cattle comes from that perspective. I'm not part of a ministry or any government agency. So just to bring everyone back up to speed, of course, where are we now with zoonotic avian influenza? And we're pretty much in the same place we have been for the past couple of decades, where we continue to see these viruses spill over into humans. So what's up on the board here is just an update from the last WHO meeting, which sort of reviewed the February-September activity. And these are just zoonotic infections, so human infections with influenza viruses from animal sources. And we see there are the usual characters, H9N2, 24 cases reported in China over this period, mostly individuals, mostly younger individuals with a subtype exposed to the virus. Another H10N3, a couple of cases of them, again a subtype that we see sporadically infecting humans, and then the laundry list of H5s. I think there have been a couple of additions to this since this meeting, one in Cambodia and a recent infection in the US as well. But again, we continue to detect these avian influenza viruses infecting humans, and while there's a lot of emphasis being placed on the H5N1 in particular, we've got to keep in mind that's not the only virus out there. It's not the only one causing infections. From the perspective of H5N1, this is a virus that is now on most all continents, with the exception of Oceania. The dots on here again are just reports during the same time period. As you can see, there's dots on most all of this map. Right now, certainly from my understanding, Europe is in the throes of what looks like it's going to be a very, very busy season in terms of this virus and birds. Similarly, in the Americas, at least in North America, we had a big year last year in wild birds with spillover. We were hoping that may mean we're going to have a quiet season this year. But again, the migratory birds have moved south, and again, they brought a lot of virus with them as well. So lots of activity, lots of things going on. But sort of moving now to what I was meant to talk about here, and this is actually what happens when you ask ChatGPT to draw a surprised cow. And that's, I think we were all a bit like this cow back in March of last year when these first reports came out of influenza virus in cows, because of course we all know influenza doesn't infect cows, and certainly it doesn't infect the udder of cows, and that's what was happening in this host. It was mastitis, it wasn't a respiratory disease, so it was in the wrong host and it was in the wrong anatomical location as well. So which is why it took a long time to identify it. And so it started off as what was an animal health issue, a food security issue, but soon after became a human health issue with spillover from infected cows into mostly the conjunctiva of individuals working in these heavily contaminated environments of the dairy parlours. If you took the milk from an infected cow, there was up to 9.5 logs of virus per mil of milk in an infected cow. There's a huge amount of virus that these animals were producing, so it's not surprising we're getting splashed into the eyes of people who worked in this environment, and also those who worked in the environment of poultry depopulation as well. Of course, there's the problem with this. It's the wrong animal, the wrong location. This was in an industry that really didn't have a plan with how to respond to highly pathogenic avian influenza. And we're going to walk through some of this from the perspective of sort of the local response, the national response, and the international response as well. So from the local level, and these are the grade I've got at the top are sort of just relative grades. I think from the three responses, the local level actually worked okay. So thanks to some pretty dedicated vets who saw the problem, realized something had to be done. There was a lot of quite good collaboration across the sectors at the level of sort of the people at the coalface. Some of those paid for that collaboration with loss of customers, but they were still dedicated to the cause. There was also some, I think what worked really well was some of these informal Zoom calls set up. So I've shout out to one particular individual here, Keith Paulson, who ran the vet diagnostic lab in Wisconsin. Early on, he put together a weekly call and invited sort of anybody who had interest or knowledge in the area, including the government agencies. And that was a really critical informal setting where information could flow between individuals. As people got used to that environment, they were more likely to share novel information that wasn't necessarily prime time yet. But lots of that critical information flowed within these really informal settings. Of course, the industry professional agency organisations, so associations of bovine veterinarians were heavily involved in this as well. Again, trying to hook the people up who could answer some of the questions with the people at the coalface with the problems and with the virus samples. Originally, this virus was what we call in the US a select agent, which is sort of the highest level of inventory. Access to samples was problematic. It cost thousands of dollars to move a sample of a select agent across a state. But we were sending milk trucks with thousands of gallons of milk across the country every day. So it was kind of a silliness, and we'll come back to that later. And there's also, because this was an industry that's not used to flu, there was also some issues with the biosecurity. So you talk to a poultry or a swine producer about biosecurity, and they do a pretty good job. This was not the case for the dairy industry. sort of idea of biosecurity was to hose off your boots as you move from one place to the other. So very different levels of understanding of infection control. From the country level, this is, I gave it an E. I won't tell you how far down that scale goes, but I think this is where the US really failed a little bit. And again, a lot of it was because there was no industry plan response. The initial response, I guess, which is typical, was to keep everything tight. So not release information, not to let people onto farms to sample. And that continued through a lot of the outbreak, and to some extent is still going on now. I think from the coordination of the human and vet response, at least from the level that I sat, there was a lack of coordinated response. It wasn't necessary because of a lack of willingness. Some of it was because, particularly from a human investigation, the people that were working on these farms that were getting infected also had uncertain documentation. Actually, one of the vets described to me that actually everyone who worked in these environments had documents. It was just most of them had the same document. So again, a population that really didn't want you going in, taking their name, taking information. So follow-up was difficult. Also, the US is a republic, so the states have a lot of power. And the federal agencies didn't have the power to come in and take samples on these farms. So again, really, really difficult to do follow-up of some of these infections for a lot of different reasons. So I think from the country level, there was a pretty poor response, but lots of things that complicated it. From more of the international level, and again, this is with sort of my WHO hat on, information did flow, probably enough to make the decisions that needed. Were a candidate vaccine viruses up to date? Were these things susceptible to antivirals, et cetera, et cetera? Perhaps some of our other colleagues can talk about from a WOA FAO perspective as well. But again, limited, of course, a little bit by this national response. So with a minute to go here, I was asked to, again, provide some pearls of wisdom for you all. I don't really have any. But some sort of suggestions, and the first is pretty much a no-brainer, right? Again, these plans we have flexibility in. The US plans had flexibility in them as well, but perhaps not from the fact that it's going to be a completely novel host that they were having to deal with. And also, from the other end of it as well, the milk supply was contaminated with this virus. So when you went into a supermarket in some of these states that were heavily impacted, and every single bottle of pasteurized milk you picked off the supermarket shelf was PCR positive for H5. To actually quite reasonable levels as well. So, some complications that perhaps weren't thought of before. There was a misunderstanding a little bit of whose jurisdiction or who had jurisdiction over different parts of this. Perhaps not necessarily from the agencies themselves, but I think people, again, working the farms, working from a research response, who were the bosses at each of the stages, whether it was a cow, whether it was a bulk tank of milk, whether it was a milk on the supermarket shelf as well. Of course, different agencies had oversight of all of those, and their approaches were different. I think the next one here is sort of the clear, at least in the US, I think there wasn't a clear pathway for, time's up, for how to reduce the biosafety level associated with this virus. It took some time before this was removed from select agent status, which allowed sample movement to be way easier. It also allowed a lot more investigators to actually work on the problem. It wasn't confined to those of us that had the labs we could do select agents. And again, I think this development of networkers, and not just researchers, but these informal networks. Of course, funding helps, but they don't have to be funded. These sort of forum where people can informally exchange ideas and thoughts and problems that they have and look for solutions was really, really key in this whole outbreak. So I'm going to stop there. Bunch of folks involved, and thank you all.
Thank you very much, Richard, for this presentation and the update that you gave us. And important that there are no human cases from H5N1 in recent months, right?
Yes.
That's good. So, Carlos, may I ask if there are any questions?
Thank you very much. So I remind everyone that you can and you should get into your phones and put some questions, should you have any. whether you're here in the room or anywhere else in the planet. But while they don't arrive, I had at least one question from my side, Richard. I mean, you just said keep an open mind to the non-traditional things, the milk, the non-chickens. Are there now plans being put in the US to change surveillance systems, to enlarge them, to move into non-traditional target species? How is this evolving?
Yeah, I think it's a great point. I don't think those are there yet. I think we're still dealing a lot with sort of the outbreak response as opposed to the post-outbreak changes to these systems. But I think it's clear, with some things I mentioned, this was problematic. It's as problematic as, should an H5 infected cow be culled? So lots of discussions that are going on, but certainly nothing solid has come of that at least I'm aware of from where I sit. But okay. I suspect it's on its way.
Okay, thanks. I might repeat the question to my European colleagues later. But we have a question from the floor, please.
Hi, thank you for your presentation. I just wanted to ask that in poultry birds, are there any plans to do vaccination?
Yeah, so there are plans. Do I think that poultry vaccination will be used in the US in the current environment? I would say no. Certainly there are licensed vaccines that could be used in poultry in the US and also in cows as well. But I think certainly the potential implications for trade, those barriers are a little bit too high at the moment. And of course, we're in the political environment where we have an administration who are not necessarily pro-vaccine, and that also bleeds into the veterinary sector as well. So at least I don't see them being used, at least the near term.
Thanks.
I'm Ranshi, and I'm originally from India, but I'm doing my PhD in avian influenza in Netherlands. So I was just curious about vaccination.
Thank you very much. There have actually come a few now questions from the floor, and I mean, some of them are quite short, so perhaps I'll ask them and then you can just provide quick answers to them. But there's come three, which I think they're very all linked. First was, originally, are there evidences to, is it a single or a several introduction from birds to cows?
Easy. Do you want to do that one first?
Yeah.
So one major single introduction somewhere early 2024 that spread. There have been two other introductions subsequently with different viruses, but they were maintained locally and haven't spread. So most of what we're dealing with one introduction.
Then a second short one. Have you seen any cases of influenza in humans from the ingestion of contaminated foods?
Of contaminated food? No. It surprises me because there is raw milk consumption is a big thing in parts of the US, and we have not seen it yet. No.
And perhaps we have time for one last one here, perhaps a future-looking one. Do you expect H5N1 to spill over to cattle in Europe?
I say yes, absolutely. I would say it's already happened. But I think the difference being the US way of raising cows, which I knew nothing about at the beginning of last year, the US moves a lot of lactating cows around the country, and this is a lactating cow issue. Other countries don't move those cows around as well. So I would suspect there has been infections in dairy cattle in Europe, but because the cows are not moving, it's been localized and really hasn't been identified.
Thank you very much, Richard, and thank you for giving us the perspective from across the continents. So now we come to Europe, and I invite my co-chair, Angeliki Melidou, to start this presentation, which she will share with my colleague, Andrea, from the European Food Safety Authority. Please, Angeliki.
Thank you very much. And I will be very short. I will try to focus a little bit now to the European situation and where we are with our risk assessment and with how we assess it in Europe. So as we don't have any confirmed human cases from H5N1 2344B in Europe, in EU, EEA, we do have in the UK, but not in EU, EEA. And the transmission from infected animals to humans remain infrequent also elsewhere. There is no sustained human-to-human transmission. And we do know that these viruses that are circulating they remain avian-like. They prefer avian-like receptors. The majority are sensitive to available antivirals used in humans and are covered by the available candidate vaccine viruses from WHO, and also they match well with the pre-pandemic vaccine that is authorized for use in Europe. So considering this, the risk assessment for the human infection in EU/EEA remains low for the general population and low to moderate for those that are occupationally or otherwise exposed to infected animals or the contaminated environment. Having said that, of course, we continue to monitor the situation very closely and update our risk assessments. And for that, we work very closely with EFSA and the European Reference Laboratory for Avian Influenza. And we produce this quarterly monitoring report with the situation update and the risk assessment. At ECDC, we also provide any situational updates in our weekly CDTR, the communicable disease threat reports that we publish. And I will try to summarize in a nutshell what we have done in the past couple of years together with EFSA to help countries prepare for cases in Europe. We have worked on case and outbreak investigation, both from ECDC's side on a case investigation protocol, but also together with EFSA on a coordinated One Health protocol that my colleague Andrea will talk to you about. And we have worked on several documents on preparedness, so the scientific opinion on preparedness, prevention and control, that I will give you some information, and other documents as well. And there was a CIMEX organized by the European Commission last year that ECDC, EFSA and the EURL for avian influenza participated, and also the member states participated as well. On surveillance, both ECDC and EFSA from their respective mandates have published documents on surveillance in humans and animals, respectively. But we have also produced a document together on the testing and detection of zoonotic influenza in occupational settings. And on the laboratory support side, from ECDC side, we do have lab support covering also avian influenza, if needed, from human cases, with wet lab, bioinformatics, quality control for the labs, and trainings, as well as centralized support. A little bit, I will focus a little bit more on this ECDC EFSA scientific opinion on preparedness, prevention and control measures to zoonotic influenza, where we did a mutation analysis and assessed the phenotypic traits acquired by all of the sequences that by the viruses for which there are sequences in GISAID, and assessed whether they have acquired traits linked to mammalian adaptation or zoonotic potential, and provide also a list of mutations that we consider important to monitor through our molecular surveillance, both for animal and human cases. And EFSA proposes additional surveillance activities in animals and biosecurity measures. ECDC, on the other hand, proposes activities for enhanced surveillance in humans in this document. And we also discuss in a One Health approach other preparedness, control and prevention measures as well. And as I mentioned, there are another two documents on monitoring and testing individuals exposed to infected animals, how to monitor for 10 to 14 days after last exposure, how to guide management of confirmed human cases and contacts of human cases, and which testing methods, testing strategies to use. So I'm happy to provide the links of these documents. You can contact me in the chat of the Skype app. Happy to provide this for you. And then I'm happy to introduce my colleague Andrea and ask her to join me here on the floor to continue with the One Health approach to investigations.
Yeah, thank you, Angeliki. And it's a pleasure to be here at SKIDE.
If you need to press a bit, yeah.
Yeah. So I have been asked to present to you this the proposal of EFSA and ECDC for One Health investigations and management of zoonotic influenza outbreaks. It's a report that has been recently been published, and in the interest of time, I'm not going to go into much detail. I rather invite you to look this up in the report yourself. So an outbreak of zoonotic influenza can be starting or detected in a range of populations. These can be poultry or wild birds, but also mammals such as dairy cows and humans. And in all of these situations, these outbreaks need to be investigated to characterize the risk. Of note that also the detection of the virus in environmental samples can warrant an investigation. So, depending on the trigger, the respective competent authority starts the investigations as a first responder, and they apply the measures that they have to take according to their legislative framework. On the slide, the example that you see is an outbreak of avian influenza in poultry, and in green on the left side, you see the actions that the veterinary authorities take, and in blue on the right side, the actions of the public health authorities. And in the center, I apologize that it's not so visible, but I refer you to the document. In the center, we have outlined the additional measures and actions that have to be taken to turn this into a One Health investigation. And just by looking at this, it's obvious that already the competent authorities have a lot on their plate to take care of this situation. So if we want to make sure that these additional elements that bring it to a One Health level are happening, it is very important that these are very well prepared in advance in peacetime. So this is why in the document we are suggesting to develop a One Health strategy, and we explain why it is so important and what it should be entail. On the left side of the slide, you see the key elements of such a One Health strategy that we are explaining in the document. And we are also providing links to tools that countries that are establishing their One Health strategy can use in this approach. For example, outcomes of the cohesive and the matrix project of the One Health EJP. But the key, the cornerstone on which this One Health strategy needs to be built is the political will of the relevant actors, and this will has to be mirrored by making available adequate resources. Now, we also think that you have to take it one further step by developing specific action plans and tools that are really geared for zoonotic influenza, and these tools, such as checklists, information leaflets, risk assessment models, they should be jointly developed by the relevant stakeholders and disseminated to all actors. And they also need to be trained and tested in simulation exercises to assure that they can be successfully implemented when an outbreak occurs. And to conclude, if you would like to hear more One Health information on avian influenza, please join us in our scientific breakfast seminars that we are organizing at regular intervals. In these seminars, EFSA, ECDC, and the EU Ref Lab for avian influenza bring the latest information on the table. And we also invite countries to present their experiences. For example, recently Austria talked about how they are setting up their One Health strategy for avian influenza. So if you're interested, just go to the link, register, and you will receive invitation, agenda, and links to join the seminars. And with this, I thank you very much, and I hand back to Carlos and Angeliki.
Thank you. Thank you very much, Andrea and Angeliki, for the perspective from the European agencies who are responsible for some of this surveillance and the preparation of the advice on this risk. Again, we open to the floor, and the questions have started to pop up. So First one, and then I never know, you just need to look at each other and decide, or both, give it a try. Are simulation exercises conducted collaboratively? And I dare to add, not just between agencies, but also member states.
So yes, this one that was specifically on avian influenza last December, and it was really successful. It was conducted collaboratively between the agencies, so to the technical at a technical level, we collaborated very closely for months to build the scenarios and all of the aspects related to who will participate and technicalities. But we did have a very close collaboration and working group together with EFSA and the European Reference Laboratory for Avian Influenza on this, and with the European Commission.
Thank you very much. I also keep looking always to Martin, who keeps control of the room. Should any questions be popping out?
Madam, would you like to come to the microphone, please?
There we go.
And if you could just say your name and the organization you represent. Thank you.
Yes, hello, thank you. I'm Bolette Søfo, I'm the State Serum Institute. So you, as I understand, you suggest quite close collaboration and quite distinct ownership of the different domains. So do you know how well that is established within the different main member states? Because it's notoriously very difficult. So, and I know that the work that you suggest might be quite hard to actually fulfill.
So I guess we can hear this from both perspectives. First the human and then the veterinary.
So from the human health side, maybe I can refer to the FEPA missions that we are currently undergoing through the ECDC new mandate. We have to evaluate and support the countries with their preparedness plans updates, and we are visiting the countries and evaluating their systems, and through this that we have done so far, it seems that countries are at variable levels of establishing or updating these action plans. So we do not have a full picture because not all countries have done that so far, and the reports are publicly available. But it seems that, for example, one aspect that needs further improvement is to build these working groups, intersectoral working groups in peacetime, to exchange information, then data in peacetime. Let's consider that we are now in peacetime. So this is something that we usually find ourselves recommending to improve.
Andrea?
Yeah, I think what I would like to add is that, yes, I agree, it is difficult. We know that it's a lot of effort, but I guess in addition to the political will that I mentioned already, I think in many countries you probably have to take some legal provisions. You have to, as it was also mentioned yesterday by Karin Nygård, for example, that you may have to implement some laws, legislative instructions to make it happen, and then obviously also make funds available.
Thank you very much for the question. And perhaps I have one last question here also from my side, a little bit in the same as I asked Richard, perhaps Andrea. We are observing viruses emerging with slightly different patterns, making species jumps that, like the surprised cow face, should have not happened. Are we envisioning to advising authorities in Europe in changing surveillance systems, patterns, what should or should not be surveilled, how to carry and to be better prepared, or are we not yet there?
Yeah, so if I may, this is a question that the European Commission repeatedly asked EFSA to look at the epidemiological development and review basically what is currently done in terms of surveillance and what could be, how the current surveillance systems could be adapted, for example, to also identify the H5N1 B313 virus should it, infect dairy cattle in the EU. So yes, this is a current process, and then followed by the risk assessment that we do. Usually it's followed up by changes by the risk manager of the legal provisions.
But not many changes yet done? Or
Sorry?
Are there any big changes already recommended? Not yet. in terms of our surveillance solutions?
I would say that that these are currently revised and updated. So yeah, that's taking place. For right now, for the dairy cattle, we have just the Animal Health and Welfare Panel has just yesterday adopted an opinion where the risk of the infection of H5N1 B313 infection of EU dairy cattle has been adopted. So that will be published soon, and there will be some recommendations regarding control measures that could be taken, but also adaptation of surveillance to detect it.
Thank you very much. So we will stay tuned for the opinion that has just been approved. And with this, I thank you both, and I give it back to you, Angeliki, to introduce the next.
Thank you very much, Carlos. And then I would like to invite Alice to deliver her presentation. Alice is from the European Reference Laboratory for Avian Influenza. Over to you.
Thank you, Angeliki, for the introduction. So in this presentation, I will focus on avian influenza virus surveillance in Europe, how it is implemented, and our move towards a coordinated One Health approach. So in the last 20 years, there have been two significant changes. The first one occurred in 2005. Before 2005, all the avian influenza outbreaks caused by a highly pathogenic avian influenza virus were reported exclusively in domestic birds. However, in 2005, for the first time, a highly pathogenic virus, the H5N1 of the goose guangdong lineage, jumped from domestic birds into wild migratory birds. And this happened in China. And through wild bird migration, the virus spread from China to Europe, to Africa, and to the Middle East. And since then, periodically spread of this strain from Asia to Europe, Africa, and also North America have been reported. The second big change occurred in 2020 with the arrival in Europe of one specific clade of the goose guangdong lineage, the clade 2.3.4.4b. And for the first time, this virus remained well entrenched in the wild bird population, and it is still persistently circulating in Europe. And since then, Europe became an important hotspot and also a virus source for the other continents. Indeed, from Europe, the virus spread back to Asia, spread to Africa, and also to the Americas. Moreover, we assisted to a rapid expansion of its host range. Indeed, it started infecting a wider number of wild bird species, but also multiple infections have been reported in different mammalian hosts, including humans worldwide. We also assist, this virus also showed a high propensity to go through reassortment events, and just in Europe, we identified more than 90 different genotypes. So given this continuous evolution of the situation, continuous amendments and updates of the legislation to adapt and face the new epidemiological scenario were needed in Europe. So based on the animal health law in Europe, surveillance in birds is compulsory in all the European member states, and with the aim to early detect highly pathogenic avian influenza viruses in poultry and wild birds through active and passive surveillance, but also to identify low pathogenic avian influenza viruses that can evolve into a highly pathogenic form, and also to contribute to increased knowledge on highly pathogenic and low pathogenic viruses posing a potential zoonotic risk. And to fulfill these aims, each member state needed to present a surveillance program based on the epidemiological situation, on the identification of the risk areas for virus introduction, and the distribution of the poultry farm. Moreover, the European Union also recommended to include mammalians in the surveillance plan, in particular in the areas where a high level of virus circulation is detected in birds. And recently also the EFSA Sentinel project has been financed in order to improve the active surveillance in wild birds in a certain hotspot area of Europe that have been identified as at a high risk for virus introduction. And what happens in case of an outbreak? So this triggers a lot of secondary action. If a highly pathogenic outbreak is reported in domestic birds, immediately control measures should be undertaken, such as stamping out and the establishment of a protection and a surveillance zone around the affected farm in order to prevent any further spread of the virus. Moreover, any highly pathogenic outbreak needs to be immediately notified to ADIS, that is the European Animal Disease Information System, and this notification will be immediately and automatically transferred to the WOA Global Animal Disease Database. It will be also available online, for example, in our URL data portal, and all the member states will be promptly informed. Also, the genomic surveillance is highly recommended in order to be able to follow the virus evolution, to rapidly identify the emergence of new resurgent viruses, or to identify the emergence of new mutations that can increase the virus zoonotic potential. And all the genetic data should be submitted to GISAID or at least shared with the URL for the analysis. In case of an outbreak caused by highly pathogenic strain, also all the exposed persons should be identified, monitored, and tested according to the ACDC recommendation. In order to improve the disease preparedness in a One Health approach in Europe, the European Commission requested the ACDC and EFSA to collaborate together in order to provide regular updates on avian influenza situation within Europe and globally, and constantly update the risk assessment. So to this aim, EFSA, ACDC, and the URL in collaboration with a group of 5 experts, every 3 months collected information coming from different sources, from the databases, ADIS and WAIS, but also we actively collect data from the member states, from literature review, from news and media reports, from personal communications of all the outbreaks that occurred in wild and domestic birds and in mammals in Europe and worldwide. At the same time, ACDC collects all the information regarding the human cases, and also the genetic information of the genetic characteristics of the circulating virus is provided in this report. Generally, the report covers a period of 3 months in order to have almost a real-time update of the situation, and it is divided into 4 major sections: the introduction, the assessment with the description of all the outbreaks in the different species and a description of the genetic characteristics of the virus, the conclusions, and the options for response. And these options for response are the actions that should be undertaken in order to manage the risk for animal and human health, given the current epidemiological situation. I'm not going through all these options for response that you can easily find and read from in our reports, but I wanted to dedicate my last few slides just to speak about where are we now in terms of the application of One Health approach for avian influenza. So in the last few years, a lot of step forwards have been done with the development of new tools for the real-time monitoring of the genetic evolution of the virus, for the rapid identification of new reassortant or of the emergence of new mutations that can increase the virus zoonotic potential, or can, or for example, that confer resistance toward antiviral drugs. We also established developed new protocols in order to be able to detect the viruses from new species that previously were not affected, or new matrices like milk. We have also strengthened the collaboration between animal and public health sectors with improved guidelines, enhanced legislation, simulation exercise. Some countries also started to implement some environmental surveillance for early detection of the virus, but also in a view of pandemic preparedness with wastewater testing. And also we reinforced the international collaboration. An example is the OFLU, that is the WOA-FAO network of expertise on animal influenza. And an example of the activity of the OFLU in collaboration with the WHO is the update of the candidate vaccine, or for example, we work with the OFLU for the harmonization of genotype and clade nomenclature system, and so on. Yeah, okay. But there is still a lot to do. Indeed, as you can see from these maps that I took from our reports, surveillance is not homogeneous around the world and also within Europe. And a clear example of a gap in surveillance is what is happening now in Cambodia. In Cambodia, since October 2024, 16 human infections caused by the H5N1 have been reported in face of only 27 notifications in birds. And these gaps in surveillance is mainly due to disparity between resource-rich and resource-poor regions, but also there are some remote geographic areas that are covered by wild birds during their migration that are really difficult to reach, and from which obtaining samples can be really challenging. And also surveillance in mammals is still insufficient due to limited systematic sampling methods and socioeconomic constraints, but also because infections in mammals can be mild or associated to atypical symptoms. And there are still gaps in surveillance in humans due to variable routine testing of exposed groups in different setting countries, or limited mechanisms to detect mild or non-symptomatic infection, especially when the link with the animal outbreak is not so clear. And as you have seen from all our presentation, we are now really focused on the H5N1 virus, because this is the major global problem now, but we shouldn't forget about the other low pathogenic viruses that have been reported to cause several infections in humans. And some of these viruses are currently endemically circulating in poultry population in some geographic areas. And for some of these viruses, there are several studies that clearly show that their pandemic potential, and all these low pathogenic viruses are not notifiable, and so we do not have a clear picture of the extent of their circulation. And my last slide. Okay, so the most important message that I want to give you is that an integrated surveillance is the winning approach, as wild birds are the major global vector of this virus, as they can carry completely asymptomatically the virus around the globe through their migration. However, the virus can also have a great impact on the wild bird population. And a clear example of this, it is what is happening now in Europe, where thousands and thousands of common cranes are dying due to infection with the H5N1. Clearly, wild birds are also the major source of the virus for the other animals, for example, for wild and domestic mammals and for domestic birds. And this virus for domestic animals can have a huge economic impact, and also domestic animals represent the ideal environment for the virus amplification and also for the virus evolution toward forms that can be more virulent or can have a higher zoonotic potential. And the farms represent a crucial and important contact point between animals and humans. And in this context, also environment is important because it can be highly contaminated and can be a source of the virus for animals and also for humans. And with this, I conclude, and I thank you for your attention.
Thank you very much, Alice. Thank you very much for this insightful presentation. We have time, I think, for one question. You may take your seat. Thank you. One question. I was wondering if you could tell us a bit more about how genetic data are used, because we know that it's really important for outbreak investigations, especially if there is a human case, also to link it to the source. And if there are any gaps in data collection in that sense. Thank you.
Yes. So genetic data is extremely important because thanks to the genetic data, we are able to monitor the spread of this virus also among different continents to identify clearly the source. But it is also an important early warning system to rapidly detect viruses that can have an increased zoonotic potential or resistance toward antiviral drugs. And so that are really strategic information, but they are really crucial if they are promptly shared in real time. Unfortunately, this is still not the case, and there are still a lot of genomic surveillance gaps from several geographic areas for technical reason, also because it is quite challenging, and so.
Thank you very much. Thanks a lot, Alice. And we have some more questions, but we can maybe take them at the Q&A a bit later. Over to you, Carlos.
Thank you very much. So we keep with our trip around the continent, and now we go and focus on the national example. And for that, Ramona Trebien from the Statens Serum Institute in Copenhagen, the floor is yours.
Thank you. Yeah, so thank you very much for the introduction and for letting me present today. I will give a presentation about One Health in practice from a laboratory perspective. So just to give you a brief introduction to the history of Statens Serum Institute. So SSI, as we call it in short, is under the auspices of the Danish Ministry of Health, and was established in 1902 and have been a public health institute for Denmark since then. And we have some core functions. It's the surveillance of infectious diseases. We do specialized diagnostics. We ensure vaccine supply to the Danish population. We have preparedness, and we are a research institute. But this changed, not all these tasks, but in 2017, together with University of Copenhagen, we were granted what we call the public sector services within veterinary matters. From 2020, it was enforced by the Danish Ministry of Environment and Food. So we became a One Health Institute since 2020. And the consortium is outlined here. So we have the University of Copenhagen Department of Veterinary and Animal Services, where veterinarians are educated and where we have expertise in animal health. And then together with us at SSI, where we have the public health side and where we also received a great deal of the experts already working in the veterinary preparedness on another university before it was granted to this consortium. So we have some tasks which are very similar to the old tasks that also were present on SSI before. So it's scientific advice and monitoring, surveillance of infectious diseases, preparedness and research. And to give you some of the examples, we have some of the very contagious severe diseases in domestic animals. We have the big five, we call them. It's foot-and-mouth disease, swine fever, classical and African, and Newcastle disease, and then avian influenza, which is the topic today. And some of these are only a problem in animals, but as you know, avian influenza have this zoonotic potential. And we have a 24-hour, all year round, on-duty situation where we can be called from the food authorities, and they call and say we have a suspicion of a clinical outbreak in poultry, and then they submit the samples either by helicopter or by the police, so we can rapidly get the samples and test them all year round. But beside these big five, we also have approximately 80 other infectious diseases, where some of them also of zoonotic. For example, rabies, swine influenza, and West Nile. And then we also, because we didn't have the facilities to handle some of these diseases in animals, so the laboratory facilities used for animal pathogens is a bit different because there is another perspective. We are not allowed to, anything must not go out of the lab. So we really need these high containment buildings, especially for some of these exotic viruses that we are not have in the country. So it's a bit different how the laboratories are arranged and how the procedures are when compared to some of the human pathogens. And if we go to the example where I know most of, it's the influenza part. So I'm heading this section for influenza and respiratory viruses. And we have always been the National Influenza Center for WHO. A long time ago, we became that. And we are also the operational contact point for influenza microbiology. But the new thing is then since 2020, then we also became the National Reference Laboratory for avian influenza and Newcastle disease. And we also performed the national surveillance of swine influenza. So our core task is research-based surveillance, preparedness. We perform risk assessments together with the University of Copenhagen and also give scientific advice. And then we also report to both national and international public health and animal health authorities. So when we then look into the laboratory flows, we of course need to have the right way to work with this. And one very important thing is that we are not going to mix animal samples together with human samples. We do not want to stand in a situation where we have a false positive case due to a laboratory contamination. So even though we are at the same institute, the same laboratory, we still need to have different procedures. And there is also a slight difference in the way we handle and which the categories of laboratories where we need to handle these different viruses. So for example, avian influenza is both the old classification OIE-free and BSL-free, whereas human and swine influenza is a BSL-2 pathogen, so it's in different laboratories, and still we also need to separate swine and human influenza. But we use the same methods, and this gives the big advantages to have this One Health when we talk about the laboratory part. So a lot of the work we're doing is whole genome sequencing and also phenotypic characterization, which are performed fairly with the same methods, but still in different flows. So I will say there is a lot of synergies to have this One Health approach, but there is also some challenges, and I just listed some of them. So we definitely see that we are able to have a faster reaction on disease spread and prevention to both people and humans because we have the data in the same place. We had a better overview of diseases in both humans and animals and also at the interface. And then we can harmonize the assay. So this is very lab technical, but this is really an advantage that we can go and see what is the most optimal in the avian influenza. And if we have a case suspected for avian influenza in a human, we can use the same methods. And also that we do the subtyping and characterization, have these data in-house, also makes it easier, faster, and will be better to access and also compare these viruses. An important thing is that we get improved knowledge, so we have a better understanding of the sources of the viruses and also transmission patterns. We can do integrated research, which I think is very important, and also we have on a practical level an improved synergy and also the flexibility that we can have trained personnel that can go across because we still are working with the same methods, even though it's different laboratories. And one particular thing I think is really great is that we have the experts broadening their knowledge and going across. But there is, of course, also challenges. And I think, and maybe it's been said before today, this with the different mandates. So even though we have a One Health Institute at the side, we still have different mandates for the human health and the animal health. So it's different ministries, and that's not always coordinated. Another challenge, of course, is just that we still need to have these divided lab flows. So we still need to have facilities or buildings and different equipment to use. So, of course, there is still this cost, and the classification of procedures are slightly different. And we also have implemented methods to ensure quality checks of so we are able to detect contamination. For example, if you have a sample, we think this cannot be right, we can actually go into the sample and see, is this of swine origin? And I think that's quite important when you have this One Health laboratory. One other drawback is maybe that avian influenza and human influenza have the same season period. So we are very busy in the lab at the same time. And then also we have different surveillance and reporting systems, which are very different on the human and animal side. But if I have one example where this really worked very well. So we had an example where back in 2021, we had 2 cases of swine influenza virus in humans. It was 2 unrelated cases. And it was during the COVID-19 lockdown. So the graph you can see, the gray arrows indicate the lockdown period, and then the red arrows indicate the 2 cases. And as I usually say, we found the needles because the haystack was gone. And these 2 cases, we could very rapidly see these were swine influenza viruses because we had all swine influenza sequences already in-house. So very rapidly, we could see that these viruses were of swine origin, and it was actually newly reassorted viruses only detected a few months before we saw the human cases in the pig population. And this is my final slide, just showing how this One Health in practice come in handy, and that we really need to think about this animal and human health consideration in coherence. So thank you for your attention.
Thank you so much, Ramona, for the presentation. And Angelique, I wonder if there are some questions coming from the floor or via our app.
There is one, if the seal was okay. But I was wondering, until we receive questions, whether you can tell us a bit more about the lab system and how the data are collected. Is there a common collection system for the animal and the human health side?
Actually, there has been some of the struggles with the lab system because usually in Denmark we have a personal identifier for the humans. But on the animal side, it's farms where we have a lot of animals, but we have a registration for the farm. And our usually laboratory management system are not able to handle this kind of data. So we have an additional LIMS system, laboratory management system coupled to the human system. So we still have it connected, but it is an add-on.
Thank you very much. And I see there is a question from the floor.
Hi, thank you. I'm Sophie from Robert Koch Institute. I have a question regarding the environmental samples.
Yes.
Do you also handle them, or do we have any in Denmark?
Yeah, it's here.
Sorry.
So in this morning session, in the first plenary session today, we were really talking about the integration of the three pillars of One Health, also including environmental samples.
You don't have it.
And I think Alice also mentioned that some places they have wastewater or still water samples also included in the surveillance. Do you have that in Denmark? And do you handle them or someone else?
Well, we have wastewater surveillance for influenza, but it's just influenza A. So we don't have the subtyping of the wastewater for example, H5 implemented in Denmark yet.
Thank you very much for the question. There is also one from the online audience. If you had the choice again, would you choose the joint human health and veterinary side or separate? Do synergies overweigh challenges?
I definitely think the synergies overweigh the challenges. I do think it's also, I have been working on both sides because I'm a veterinarian and I started in the veterinary field and then went to public health. And before we were one laboratory or one this consortium, there was struggles to collaborate. And I do think that's helped a lot. So we have this united DKVet consortium.
Thank you. And also maybe from the resource side to have two laboratories doing the validation of the reagents, to purchase the reagents and the protocols and validate the protocols. It's also much more resource intensive, I guess.
Yes. So, for example, for the assays that we use for detection, when we have a suspicion of a human case, we use the assays already validated on the veterinary side.
Thank you very much. Anything else?
Thank you very much. So, dear colleagues in the room and all of those following us online, we've been very disciplined. Thank you very much to all the participants. They were very disciplined with these presentations. That gives us now more or less 50 minutes still to squeeze as much knowledge as we can from these 5 experts in avian influenza and surveillance. A unique chance. They're all here. They're not leaving their chairs. So don't be shy. We have a Slido that Angeliki will briefly introduce. But while we think of the Slido, get into your apps and ask everything you can. This is a one-time chance. So don't be shy, please. And
Thank you, Carlos. Yes, I think it's up already. So if you can use the barcode and scan it and vote. The question is, from your experience, what would you consider as the biggest barrier to effective vet and human health collaboration? Option 1, lack of relevant data that I can use. Option 2, lack of human financial resources. Option 3, lack of clear guidelines, regulatory framework for One Health collaboration. Option 4, I understand the advantage of a One Health approach, but it is not relevant for my work. 5, I don't have a counterpart or collaboration partner in the veterinary public health domain, or other. So you have 1 minute, I think, and then it closes.
Very good. I see the number increasing quickly. That's good. That's good. Let's keep it going.
I think maybe we can close the poll. Thank you very much. Option 3 seems to be the winner. Lack of clear guidelines and regulatory framework for One Health collaboration. I think this came up also in previous plenaries. And the second one is the lack of human financial resources. And maybe we can ask our speakers if they can provide their opinions and views around this. Which do you think is the biggest barrier? If you agree with that the guidelines and regulatory frameworks are what is clearly missing. Maybe we can start with you, Richard.
Yeah, I'll add one, and I kind of touched on a little bit, but from, again, the experience in the dairy cattle, I think it was lack of engagement of the people who actually owned the samples that we needed to get out. In this case, it's the industry, you know. So that it's a lack of I think prior engagement with that group, because clearly, if you can't have access to some of the populations you need access to, you can have all the frameworks in place you like, but it doesn't get you far. But so me, I'm a little bit of an other.
There. And Andrea?
Yeah, I think I agree with the audience, particularly regarding the second part of option 3, the regulatory framework. I think often we see that it works well in countries because there are certain individuals in the different authorities that know each other, that work well together, but that's sort of unofficial, and it probably also doesn't really then withstand the pressures of huge outbreaks. So I guess it is important that regulatory frameworks are really put in place to give everybody the right, but also the obligation to collaborate.
Thank you, Andrea. Over to you.
Yes, I also agree with the audience, and I think that we also should find the way to increase the opportunity to have more contacts and exchange of information, because the lack of information can be really a big barrier.
Thank you. Over to you, Ramona.
Yeah, but I also agree. In Denmark, we have a coordinating group with the different authorities to try to have a framework for One Health collaboration. But it cannot take any decisions. But there is this collaboration. I think that's an advantage. But I still think there needs some regulatory framework for having the One Health approach.
Yes, and I think that countries are working now to build this in peacetime, according to our mission report.
So you go for the same one?
I think so too.
Very good. Okay, I think I'm going to be the disruptor here. I'm going to say other. And I think I need to provoke a little.
Yes.
And I would say the biggest, what can be still the biggest barrier, ourselves. And by ourselves, I mean the professionals, the disciplines, the silos. The human doctors that may arrive and say, well, we are human health, we go first, then we come vets, and what we can do 7 species, we are smarter. And the fact that we are used to our own routines and to our own ways of working, and this is a game changer, to do things differently from what we know has worked for decades. So I think I would be tempted to vote other, because our own selves also need a transformation, especially if this One Health is to work. So, okay, I give one more vote for that option. Okay, while we were sliding, some questions have arrived, and we had a few packed from before that we couldn't reach. So the ones I have here to start with go to Richard. And here the question is, can you explain when you say you do think H5N1 is in the European cattle? Will it become endemic like in the US? Does it raise the risk to human health? Would it have been several events like in the US or a one spillover? Can you take it as a little further on this?
Yeah. So, I think we started this, cows don't get influenza at all, to, okay, cows have got influenza once in the US, to now cows have got influenza 3 times in the US, only one spread. I think the situation in the US in terms of the risk of wild bird to cow spillover is probably not too dissimilar. where you are. I think what is different, though, as I said, was lactating cows move in the US, so you don't just get the one infection, you get spread, which of course is much easier to detect. So again, I think the likelihood of endemicity outside of the US is probably not great, but I think the risk of transfers, which we still don't actually understand how this virus got from a bird into the udder of a cow. We still don't understand that, but I would assume those risks are the same most anywhere. And so it's probably happening, but we're not getting the numbers of animals infected, the spread, so it's not getting detected. And so, yeah, the difference is the transfer, the risk is similar. The risk of endemicity is much higher in the US because of how we raise dairy cattle.
Thank you very much. I'm not sure if any of the others is tempted to provide more about this, but I think
it may not agree with
it. May be. It's good that it's someone outside Europe saying that it may be here. Let's not get ahead of ourselves here in the continent. Angeliki, do you want to take us on the next one?
Yes, I wanted to maybe ask Alice if there are any joint capacity building programs at the local levels. I mean, joint. I can cover the joint part because the quality assessments for the labs are done separately. So from ECDC side, we are supporting the capacity building exercises, the quality assessments for the national reference laboratories from the human side for zoonotic influenza to prepare them for diagnosis of cases in humans. But then from the avian influenza side, are there any exercises that reach the local level?
Yes, we are trying, at least for example, in Italy, we are trying to improve our collaboration in order to have an increased integrated surveillance. We are collaborating with ecologists. We are trying to improve our environmental surveillance for early detection of the virus. We are working also with the human health counterpart in order to have shared protocols, share reagents and materials. So I think that at the country level, each country is putting efforts in order to have an integrated surveillance approach. But obviously, this is really different among different countries and depends mainly from the resources, but also from the politicians and how much they push to have this integrated approach in place, and the funds, of course.
Thank you. And maybe just to refer back to what you heard about the European reference laboratories that are being now set up, and the respiratory virus one is upcoming. So hopefully it will start, it will be launched in the beginning of 2027. And then we will have one for respiratory viruses that can directly liaise with the European reference laboratory for avian influenza, and we can create this joint. There will be more opportunity for collaboration also at this level for capacity building.
Yes.
Okay, but there is perhaps again a little controversial question to be made. As we've just heard the example of Denmark bringing together vets and doctors, are we going the other way in Europe by having animal reference labs and now public health labs? Should they then not been together? Putting everyone on the spot.
So we do not have that yet for respiratory viruses. It will come in 2027, and it's covering also other respiratory viruses. It's not only about zoonotic influenza, it's also about seasonal influenza, about SARS-CoV-2, RSV. So this is covering also seasonal pathogens.
But would that competence have been more useful and better used in terms of resources by combining the pool of resources like it was done in Denmark? I'm just challenging my colleagues from both EFSA and ECDC. And
maybe I can leave now to Alice or Ramona to answer this further. I mean, from my side, I think it's something food for thought. How the labs can do this in an integrated way. But I guess it's up to also the country and how they have arranged this. As this has been traditionally, there are two different laboratories covering that, and there are also, as Ramona said, challenges at the diagnostic level that need to be different spaces, for example. You cannot isolate the viruses from animals and from humans in the same lab because there is a risk of reassortment. There are also such operational aspects to consider. So it is something that needs to be discussed further.
Very good. I have a question here that has arrived, I think, for Alicia, because you mentioned the detection of avian flu in the wastewater. So, and there's a question here about how should we interpret positive avian influenza results in wastewaters, as we don't know very often the exact location, origin, or the carrier of the infection. So how do we bring that information into the big picture?
Okay, yes, actually, we didn't detect any avian influenza virus in wastewater from our surveillance, fortunately. And yes, it can be challenging to interpret the data because actually you do not have a clear picture of the different sources, and there can be also contamination, for example, from wild birds of wastewater, but at least you have an early warning signal of some circulation of the virus.
Very good. Angelique?
Please, Tyra, go ahead.
Yeah, I have a question that is related to the previous question we had on how well the guidelines coming from EFSA and ECDC are followed by the member states. And I was thinking about if you've considered to do after-action reviews, using the One Health approach, to see what the compliance is to the guidelines for these outbreak investigation guidelines. Now, when we've had these many outbreaks of avian flu in poultry in Europe the last months.
Maybe I can take it from the human health side, because we have done a survey on this recently, and two surveys. The results of the first one have been published already. So it's variable, obviously. Not all countries. I mean, it was, I don't remember now the numbers, but countries do know about the guidance documents, and they do seem to base their recommendation to a high level on our recommendations. So it seems that they are followed, at least in theory, because in practice, I guess it varies. So surveillance systems, testing strategies are quite variable when we try to dig deeper inside how they are selecting, for example, to test symptomatic versus non-symptomatic exposed individuals. Their approaches are quite different there. But yeah, I'll stop there.
I think Andrea wanted to say something more, please.
Yeah, thank you. I really like the element that you mentioned, the evaluation of the action that has been taken. So the post-mortems of once you have established your One Health approach and your tools, you have applied them in an outbreak, and then step back, review how it has worked, all together, obviously, bring all the stakeholders together, look at which processes, which tools may have to be further developed, changed, because this is the way we are really making this work. We fall, we get up, we learn, and we improve. So these postmortems are really important, and they are as important as the simulation exercises. So it's an iterative process that you apply, I think.
Thank you very much. We have another one that has arrived some time ago, and I'm not sure if it's for you, Angelique, for you, Alice, but if low pathogenic avian influenza can mutate to HPI, as we know it's possible, why is it that as of today we keep LPI not on the immediate reportable systems, and why don't we change this?
So from the human health side, any influenza A that is not seasonal, it needs to be immediately reported. So it is reportable from the human health. So any case needs to be reported because it poses the same risk for a pandemic. Mm-hmm. So from the animal health side, maybe.
Yes, the H5 and the H7 are reportable, but it is necessary to immediately notify, but all the information can be collected and reported to the ADIS at least once a year. So, but that's just for the H5 and the H7 subtypes that are the two subtypes that can evolve into a highly pathogenic form.
Thank you very much. Angelique, you have perhaps one last question.
Yeah, I think it's again for you, Alice. Why are we seeing the H5 outbreak in cranes only this year, and what is driving this?
Actually, it is not the first year. We had also mass mortality events in 2023. So this year, I don't know the reason. There has been this introduction into the crane population. There is really a high level of virus circulation in white birds this year compared to the previous year, and indeed comparing the same period of time of this year compared to the previous year, we have 3 times more outbreaks in white birds compared to last season, and so the circulation of the virus is really high, and probably it is introduced in this population that is highly susceptible and is dying.
And we maybe can expect also a lot of more poultry than being infected coming up, and a lot more exposures in humans, which reinforces the need for surveillance.
Yes, of course. Also because the virus is circulating also in asymptomatically wild birds, and so there surveillance is should. The human surveillance should not be performed only on workers farm workers, but also for example, hunters or the workers in the rehabilitation centers. So all the persons that can have contact with animals.
This is a very important point. Thank you very much, Alice. Over to you, Carlos.
Very good. So we've come to almost 6:30. So thank you very much to all our speakers, including my co-chair Angelique, for the knowledge they shared. If I can very quickly, as a home take message, I think that we went in this last 1.5 hours over a topic, a problem, a challenge that I think clearly has been shown to crosses borders, crosses continents, but also crosses disciplines. We've seen examples of how enhanced surveillance, also for the unknown, like Richard mentioned, to be prepared for what you didn't think could have ever happened, how that brings added value. But as we went through the other presentations, we've seen examples of how joining forces, twinning labs, merging labs and capacities can bring a gradual change in the way we do the same tasks, in the way we change those tasks, but in the way we also can create new knowledge. We've seen also in these presentations the impact of new technologies, and Alice brought here the importance of combining traditional surveillance, omics techniques. We didn't have too much time to dive, and there were a few questions here we couldn't take, unfortunately, on also the aspect of how to manage wild populations and how to monitor something that is difficult to control. But I think gradually it was a call to action, that no matter if you're a vet or a doctor, the environmentalist as well, that was not so much focused today here. We had 1 bird, 2 stones, but perhaps we could have 3 stones. Please don't start stoning the birds. That's not the idea. But perhaps many of these little stones can help this topic to be better managed, so that prevention really is better than cure. And with that, once again, thank you to all my amazing panelists, and to all of you to staying all the way to the end. So that's also a proof of resilience. And back to the host, Martin.